Hello, this is Cindy. Today we're going to talk about the anesthesia chapter, which is chapter 9 in your CPT textbook. Some general information first of all. These codes are used to report services by the physician or a certified registered nurse anesthetist, that's hard to say, CRNA, who provides or supervises the anesthesia. The codes in this section are arranged first by body site and then by the specific surgical procedure performed, except for those at the end of this chapter, which have to do with radiology procedures and other procedures. You'll notice as you look through the chapter that several procedures can be assigned to one anesthesia code. Main terms are going to be either anesthesia or analgesia. Like many codes, third-party payer guidelines have to be considered before you submit these codes for payment because they have all kinds of rules and regulations around them. An anesthesia service includes pre- and post-operative visits, the anesthesia itself provided during the procedure, administration of fluids and blood, and the usual services like what the anesthesiologist monitors are EKG, temperature, blood pressure, oximetry, capnography, and mass spectrometry. The unusual monitoring that could happen that would be reported separately would be any kind of monitoring of the heart's function and blood flow using an intra-arterial, a central venous line, or a Swan-Ganz catheter. So some things to keep in mind. If you're coding for an anesthesiology practice, this is probably all you're doing. It's coding for anesthesia, and you're going to be very good at knowing what you will and will not report, and you're also going to know your payer guidelines inside out. That's the beauty of coding for a practice that uses these smaller chapters. You can really know all the codes and all the rules and regulations around them. The types of anesthesia are local, regional, general, and what we refer to as a conscious sedation. They are very different. The only types of anesthesia that are covered in this chapter are the local, the regional, and the general. The conscious sedation is covered in the medicine chapter. The difference is, with conscious sedation, you are able to breathe independently, maintain your airway, respond to verbal commands. You really aren't knocked out, so to speak. When you have general anesthesia, you're going to be completely unconscious, and you're going to be probably on a ventilator, and that's going to take care of your airway. A regional anesthesia is like a block, a nerve block, and that when I had my knee replaced, I had a spinal block, and I had a regional or a femoral block on the affected leg. So it depends on how the doctors and the anesthesiologists want to administer the sedation. And local, of course, would be when you get a little numbing shot when you have stitches put in or something like that. Some carriers require that time be included on the claim. And counting anesthesia time should begin with the preparation of the patient by the anesthesiologist for the induction of anesthesia. You're usually in the OR when that happens. And that time ends when the anesthesiologist is no longer in attendance. Anesthesia has what's called physical status modifiers, and you will often see these reported with the anesthesia code. And here they are. They are in the front inside cover of your CPT code book, so you don't have to memorize them, but you do need to understand what they mean, and you also need to understand when to use them. And that would be when you are signing an anesthesia code. Automatically think about your physical status modifiers. There are other modifiers that anesthesia could use, and I've got them reproduced here on this slide. You may see them, for example, number 22, say you're administering anesthesia for some kind of cardiac procedure. And once you get in there, it just takes the surgeon longer than it normally would. So the anesthesiologist, therefore, has to be there longer. So the anesthesiologist would append a 22 modifier to the anesthesia code. 23, unusual anesthesia, might be if you typically don't have anesthesia, but because you're dealing with a patient who is, let's say, severely mentally disabled or intellectually challenged and just can't understand what you want to do and why you want to do it, you may have to administer anesthesia. So that would use a 23 modifier. And then you see the other ones there. 53 is used if the physician elects to terminate a procedure because it's just not healthy to go forward. That's different than the patient saying, no, I've decided I don't want it. That is a different modifier. You're never going to use Modifier 47, Anesthesia by Surgeon, for the anesthesia procedures. Again, I've never used that modifier, so I'm not really sure when you would need it, but it's obviously there for someone to use if they need it. More general information that we need to remember. Those HIT Level 2 modifiers are in your textbook. You are not responsible for those in 241. There's a lot of things there that I think you would only use them in very specific circumstances. So you're not responsible for that in this course. There were some CPT codes discussed in the medicine chapter that were called qualifying circumstances for anesthesia. These are never used alone and always reported with the anesthesia CPT code. So we'll be looking at a few of those in a few moments. An anesthesia code would not be reported by the hospital unless the hospital was performing the billing services for the anesthesiologist. So really the only people using these anesthesia codes are those who are billing for the anesthesiologist. Okay, let's look at some of the review questions in your CPT textbook. I follow the usual format where I give you the scenario, then you attempt to find the code, and then we'll be looking at the answers on the next slide. These anesthesia services for a cervical cerclage where the patient is 25 years old and in good health. This is typically done when, let's say, a patient is pregnant and the cervix wants to dilate and the baby's not ready for delivery. The doctors will go in and actually sew the cervix together. This is an anesthesia service for that procedure. Don't forget the physical status modifiers. Then your main term would be anesthesia, cervix, and then there's your code. We would use a P1 physical status modifier because it is a healthy patient, so it's, quote, normal patient. Number 4, anesthesia services for an open repair for a malunion fracture of the humerus. Patient is 85 years old but healthy. 2 additional things are needed. Your physical status modifier, which is going to be P1 because this person is healthy. Then the CPT code for qualifying circumstance because this is a person of extreme age. And here would be the pathway and the codes that you would assign. I'm not sure why this particular code is for anesthesia for open or surgical procedure of the elbow, semicolon, repair of non-union or malunion of the humerus. I'm not quite sure why the elbow is thrown in there, but that's how it's written. And the repair of a malunion of the humerus is right on with what our scenario asks for, so we would use this code. Number 6, anesthesia services for a partial nephrectomy and a patient with renal cell carcinoma. 45-year-old patient also has mild coronary artery disease and hypertension treated with medication. Don't forget the physical status modifier. Okay, when it's a patient who's young, so you're not going to have any kind of qualifying circumstance for extreme age, but the patient does have mild coronary artery disease and hypertension, so that's going to give he or she a P2 physical status modifier, which would be assigned along with your anesthesia. And there is your code. Anesthesia services for a blepharoplasty, which is a repair of the eyelid. Patient is in good health. Don't forget your physical status modifiers. Well, because the person's in good health, you notice a P1 modifier. And when you look up the code, it's anesthesia for eyelid. Now, if you didn't know that blepharo was the prefix meaning eyelid, you would have to search for medical terminology either on your Google search engine or in a medical terminology book there on your desk, however you would look that up. I really can't overemphasize the importance of knowing your anatomy and physiology and keeping those textbooks handy. You will learn and remember many more things as you code, if you code for a living, but you will always find words that you don't know. So that's where those Google search engines are very, very helpful. If you don't recall a hint I had earlier in the semester, if you open your browser and in the address bar put the term that you want to search for and then a colon, that colon is the message to Google that you want a definition. And it will search for that definition and show you some hits when you open up your search page. So it's really, I use it probably at least twice a day looking up terms, medical terms that I'm not familiar with. Number 10 is anesthesia for a left lobectomy due to a lung carcinoma. Now you remember from your medical terminology, your anatomy and physiology, a lobectomy would be one of the lobes of a lung. The lung has more than one lobe. The patient also has severe chronic obstructive pulmonary disease and emphysema treated with bronchodilators. Now this time the patient has severe disease, so that's probably going to be a P3 physical status modifier along with your anesthesia codes. Remember that the physical status modifiers are located on the inside cover of your CPT codebook. If you have any questions about Chapter 9, please use the discussion board to post those questions. If you're asking about a specific exercise, please post the path you use to try and find the code. We will not spend much time on this chapter, and there will not be very many questions on the exam, but I just want you to be aware of it so that you would know to always use those physical status modifiers and keep in mind your qualifying circumstance. That's all I have for Chapter 9. Have a good day.